Namaste. My name is Dr. Bharat Vaidya. I did my BA/MS from University of Bombay in 1986. Then I was at Yale University. And then I did my MD from Catholic University of Leuven, Flanders, Belgium. I am the owner and founder of Ayurveda Sadhana Vidyalaya. We offer 3 courses. One is Ayurvedic practitioners. One is advanced Ayurvedic practitioner, which is Ayurvedic doctor program. And third and unique is Ayurdola, Ayurvedic woman pregnancy, nutrition and support. All 3 programs are approved by Department of Higher Education, Colorado. Today my topic is trauma, Shotha and Vata. Before we start our voyage, let us talk that on 29th of September, 15 days of Pitru Paksha, when we pay our respect and homage to our ancestors starts. So let us pray and pay our respect. Shantakaram Bhujagashainam Padmanabham Suresham Vishwadharam Gagana Sadusham Meghavarnam Subhangam Lakshmi Kantam Kamalanayanam Yogi Virdhyana Gamyam Vande Vishnu Bhavabhayaharam Sarvalokaikkanatham. Vaidya Prabhuram Jivanram, Dr. Popat Prabhuram, Dr. Pratap Kumar Vaidya, Bapalal Garbardas Vaidya, Jadavji Trikamji Acharya, Dr. Rubina, Krishna Bai Redkar, Father Nun, Father Estrello, Sir J.D. Hooker, Sir James Watt, all the traditional Vaidyas, healers and doctors who played important part in revival of this science, please bless us, give us healing, love and peace through our heart by which we can heal ourselves, we can heal others, we can heal Mother Earth and this universe. Amen. When we talk about the trauma, we talk about the subtle body. And when we talk about the subtle body, we talk about the ether and air elements. Through that, we are starting. How many of you remember impacted or know someone who was impacted by martial fire in Border County, December 30th, 2012. Almost 1,100 properties were destroyed due to the fire. That has created tremendous trauma on the family who went through that. My family was one of that. I know the people who went through and impacted through this fire and the scar of trauma in their mind and body. Another example is Maui, Hawaii firestorm, August 2023. So many people get affected. That is trauma. And when we talk about the trauma, already I have told you, subtle body, air and ether is the most important. Now, what is the mean by trauma? As per modern medicine, definition of trauma, as per American Psychiatric Association, is trauma is an emotional response to the stimuli with the terrible events like car accidents, rape, abuse, natural disasters, or any freak events or accident. An immediate reaction to the trauma is shock, denial, grief, sadness, depression, etc. But the longer terms are flashbacks, mental stress, sadness, physical pain, mental pain, faster heart rate, nausea, foggy mind, etc. When we talk about trauma as per Ayurveda, I remember Acharya Prasthapada. As per Acharya Prasthapada, trauma is chinna bhinna aghataj manas, disturb and distorted blow or aggression to the manas. Here I remember our Vedic seers, that our Vedic seers have studied healthy mind and applied concept to study the manas, psychology and physiology. While Charcot, Jung, Freud, everybody have studied disease mind and applied the concept. This is one of the most important difference while we treat the trauma in ancient Vedic, Aryan psychiatry and modern psychiatry. And that we should not forget. Again, when we talk about the trauma, two things are coming in the mind. Sarvesham roganam mulaha kupita malaha. Vitiated toxins are the root cause of every disease. And number two, mana evam manushyanam vyadhinam karanam. Psychology and psychopathology are the root cause of every disease. And that also we should not forget. When we again go through the modern psychiatry, they have divided trauma into the three aspects. Number one, acute. This trauma results from the simple or single impactful event in the life. Like one car accident, which made its imprint in the mind and body. Second one is chronic. This trauma results from the repeated and prolonged event or behavior such as bullying, physical abuse, early childhood trauma, domestic violence, and the third is complex trauma. This trauma results from the exposure of different and multiple traumatic events which ultimately affect someone's development and the sense of safety in the world, like constant regular timing interval bullying, constant regular timing interval raping, etc. When I talk about this kind of trauma, I remember one of the Ayurvedic pathology of Aghataj Unmad. Aghat means start, blow. That trauma, that start or blow which effect on the mind and body And our Acharya have mentioned also about the Aghataj Unmada. In Ayurvedic psychology, when I go through it, or Manas Shastra, what I call, when we look at the Vedic seers, they have defined the symptoms of the trauma or Aghata trauma. And now compared with the modern medicine and psychology, you will be amazed. There is so much similarity among both the symptoms. Ayurvedic name, Sanskrit name, Radhya Drava. Modern name, palpitation. Number one. Number two, we are talking about trauma in Aghata Junmada. Ayurvedic Sanskrit name, Swasa. Modern terminology, heavy breathing. Number three, Sanskrit and Ayurvedic terminology, Kshuddha Nash. Modern, no hunger. Number four, Ayurvedic and Sanskrit terminology, Agman, gas. Modern, I told you, gas. Number five, Atisara, diarrhea. Ayurvedic name Atisara, modern name diarrhea. If you remember and go through Madhav Nidan, the book of Ayurvedic pathophysiology, which is one of my favorite class, and I compare with modern medicine and teach. Shokaj Atisara, Atisara due to grief. Atisara, diarrhea due to sadness. Diarrhea due to somebody died and that shock. Exact match what Aghata Junmada is mentioned, plus trauma. Why? Ambuva Shrotamsi, water resources are getting vitiated. That pathology is coming. We are going to discuss of that also. Then, Dhatu Kshaya, weakness of the tissue. Daurbalya, weakness. When we talk about Dhatu Kshaya, we have to remember rasa or plasma. Plasma vitiation, one of the symptoms is a sadness or grief and weakness. We are creating also the pathophysiology of trauma, Vata and Shotha. Inflammation. Kampa, rigors, symptom of Vata. Nervous system. Ekagrata abhav, lack of concentration. This is Sanskrit, this is modern. Krodha, anger. Krodha, as per our Ayurveda and Vedic pathophysiology, it is coming under ether. Manas, coming under ether. That's why I told you, subtle body, air element and ether is very important to treat the trauma. Glani, melancholy. Bhaya, fear. Again, we talk about the ether. Compare with elements. Shirovedana, headache. and sadness. These are symptom mention of aghata junmada or trauma in Ayurveda. When we talk about Shotha or inflammation, inflammation is always integral part of every trauma. When we talk about the inflammation, we talk about the Vata. What is Vata? Adbhut Vritti Shakti, Anubhut Vritti Shakti. It is a kinetic energy. Vata governs the nervous system. Air element governs the nervous system. And what is the seat of, as per Ayurveda? Sangnavaha nadis, complete nervous system. And spinal cord is the seat of the manas or the psyche. Connect the dots and you will get your answer. Vata moves. But when that Vata gets vitiated and obstructed, it creates inflammation. Already we have talked about rasa. And one of the main Vata symptoms is ruja, pain. Here I remember Harith. Harith was a physician in the kingdom of Persia. I am talking about Zoroastrian Empire. Nasti ruja vina vatam. Without air element obstructed or vitiated, there can never be pain. This is so deep and fantastic by Harith. Vedana and Shotha. Pain and inflammation are always goes together. When we look at the blood report, I always teach my students, don't look only the RBC, CBC, look at the eosinophilia. Precursor of inflammation. That Vata get obstructed. In every trauma, an inflammation occurs. Why? Because already the symptoms, Pitta are also getting vitiated and Kapha is also getting vitiated. Vata is already vitiated. Rasa Dhatu, one of the main important symptom of the vitiated is the glani, okay, sadness, depression. Here I remember my father, Dr. Bharat Vaidya. He was chief medical officer in St. George Hospital, 70% Ayurveda, 30% modern medicine. Trained under Anglo-Indian doctor, Dr. Dhyanchand Pardhi. He was editor-in-chief of Ayurveda Jagat. Jagat means world. Monthly newspaper. And to treat Manasva Shrotamsi, he used excellent word in Ayurveda Jagat in editorial page. Develop Niram Vritti. Not only your physical ama, but psychological ama is also important. Dr. Pranjivan Das Mehta, founder and ex-dean of the Gujarat Ayurveda University, called early in the morning to my father Dr. Vaidya, I went through whole Sanskrit dictionary but did not find the word Niram Vritti. You gave the excellent word to our Sanskrit dictionary and Ayurveda, which is missing when we treat trauma. Develop Nirama Vritti. Our psychological perception also should be without ama. Because that ama create obstruction and create inflammation and Shotha. And Nasti Ruja Vina Vatam, there can be never pain without air element. I remember here Dr. Shiv Charan Dhyani, ex-dean of the Gujarat Ayurveda University, 1963. The postgraduate study. He gave excellent some of the symptom of the Shotha. Agni Mandhya. Already we have seen in Aghata Junmada and trauma, one of the symptoms, Shudha Nash, no hunger. Of course, serotonin in GI, gut bacteria are so important. Seat of the blood, liver is so important. Anybody doing and treating it? No. Another one is Krumi. Pathological Krumi create psychological Krumi parasites. Psychological Krumi create pathological Krumi parasites. Again, I remember my dad, his excellent article, Krumi Vichar, Thought on the Parasites in Ayurveda Jagat, 1968. One of the biggest missing piece of the modern science in treating the trauma. Charak was knowing it. And that's why he put Vidanga in Shiro Virechaniya Dashe Mani. Best vermicidal for Shiro Virechana, Charak has put Vidanga for pathological as well as psychological Krumi, physical and metaphysical. So as per Shiv Charan Dhyani ji, Agni Mandil, Am, Niram and Ama. Niram Vritti, develop Niram Vritti, pure psychological perception without toxin. Our world is in dire need now. Sang combination of the pathology, localization, Shotha. We are talking about vitiation of rasa and dakta, usseda, edema and inflammation. Always there in every trauma, Vata is related. This is Ayurvedic Shotha pathophysiology. And what is Shotha? Inflammation as per modern medicine. Again, complex biological response of the vascular tissue to the harmful stimuli. Now compare with the more American psychiatry definition of trauma, what we have discussed earlier. And then compare with Ayurveda, so distinct, so perfect and to the point. Such as pathogens, damaged cell, or irritants inflammation is a protective attempt by the organism to remove the injurious stimuli and to initiate the healing process. Same thing happened in trauma. Injurious stimuli. Every trauma, Shotha is always there, and Shotha is not possible without the vitiation of Vata. Then you may ask, what is then Ayurvedic pathophysiology? How I observe the disease and how I treat the disease define Ayurvedic pathophysiology of Shotha. Dosh Vat Pradhan Tridoshik. Already we have discussed Rasa, Rakta, Kapha, Vata, and Pitta. Inflammation is a Pitta. Rasa Dhatu, Kapha is a Mala of Rasa Dhatu. Eosinophilia, we require to dissolve that inflammation. Dosha, Vat, Pradhan. Pradhan means main, Tridoshik. Dushya, Dhatu, Rasa, Rakta, and Ambu. Hydraulic system, water resources, Ambu Shrotamsi. We are talking about pathophysiology now we are creating of the inflammation, which is integral part of the every trauma. Dosh, Vat Pradhan Tridoshik. Dushya, Rasa Rakta and Ambu. Shrotamsi, Rasava Raktava Ambuva. Shroto Dushti, vitiation of the Shrotamsi. Sangha and Vimarga Gaman combine and take the different courses because there is obstruction in Manova Shrotamsi. There is an obstruction in Shaririko Shrotamsi. So Dosh, Dushya, Shrotamsi, Sroto Dushti define the pathology. Sangha and Vimarga Gaman. Trauma is a long-term disease. This is the pathology one should always remember of every trauma. When we talk about again the trauma, we talk about the inflammation and we talk about the Vata and nervous system. So what is the treatment? How we can treat the trauma? Only with herbs? By controlling the Vata? No. It can't, it shan't, it should not be. Yukti Pashray and Deva Pashray. Chikissa. We are in Chikissa, treatment. Yukti Pashray, you use your Yukti and yes, management of the medicinal herbs. Food and diet play a very important role. And then lifestyle. And when we talk about food, diet, and lifestyle, another one chikitsa is most important to treat every inflammation. Shotha in the trauma is Deva Pashray chikitsa. Here I remember Sushut. If Charak is saying root cause of every disease is pragya, aprad, mistake of intellect, Sushut is saying bhuta bhishangatva, infection and infestation, mind blowing. Sir Richards in Illustrated Weekly of India, 1933, Sushud had a complete knowledge of infection and infestation. Article I am having in my archive. Sushud say it is not only bacterial, viral, or fungus. Bhuta bhikshangatva. There are energies, there are grahas. There is surrounding. What we see nowadays in our daily life: hate, war, violence. Do you think it is not affecting the person who went through the trauma? Of course it is. That's why I said, Shushut, Bhuta Bhishangatva. Mistake of intellect, mind blowing, no doubt. But then, Shushut, why nobody ever put any emphasis of this important word of Shushut, which I teach to my students? Bhuta Bhishangatva. There come Deva Pashraya Chikissa. Mantra chanting. I remember one of my patients, war veteran from Iraq. She was on severe painkiller, oxycodone and morphine. I am unable to sleep at night. Mantra helped her. First time in her life, she was able to sleep. Dhanvantari mantra. Achyutananda Govindam Namocharana Beshajat Nashyanti Sakla Rogaha Satyam Satyam Vadamyaham. Infinite pure joy, which is everywhere. Thy name is Almighty. Achyutananda Govindam Namocharana Beshajat Nashyanti Sakla Rogaha. Destroy every diseases. Satyam Satyam Vadamyaham. Dhanvantari Uvach. Dhanvantari spoke. She was able to reduce her painkiller. And she said, no, Dr. V, now I don't chant it only at the night when I want to sleep. I chant it every time. Deva Pashraya Chikissa in every Shotha, inflammation and trauma. Why? To align the air element and treat the ether. Subtle body. Puja. Mala beads. Yoga. Meditation. Prayers. Respect to elders, teachers, and parents. Life doesn't go up like a ladder. Life grows up like a tree. And our teachers, our elders, and parents are in the root of that tree. This basic principle, every school in US should teach to their students. Gurus and, of course, cows. Panchagavya Chikissa. Mind-blowing treatment in trauma. In America, we should have Panchagavya hospital. 5 things of cow. When we talk about trauma, we talk about koshas. Annamay kosha, manomay kosha, gnanmay kosha, vignanmay kosha, anandamay kosha. How we are going to reach that? Diet, lifestyle. Why? For example, cow, Panchagavya, 5 things of cow. I remember here, Chernobyl, when Russia, the atomic reactor burst, Russian government imported thousands of tons of the cow dung from Gir cow from India. Gir is a place in Kathiawar. Gir is a place of the Lord Dattatreya and Shiva. And cow dung is only cheapest and the best means through which atomic rays cannot pass through. The Russian government put their scientists in the house made up of the cow dung. Panchagavya chikitsa in every inflammation and trauma. Semi-precious and precious gems. And one more important is Pitrudosh Puja, ancestors. Here I would also like to share with you one more case. One of my patient, generations of suicide in the family. Please take away this trauma from the walls around me. We went to India and did Pitrudosh Puja in 200 years old, near the 200 years old lake in Bhagwan Parshuram Tirtha in Bombay, which is forgotten, and that is where Vaidya Prabhuram Jivanram went into Mahasamadhi. Why? Because our universe is nothing but sound and frequency. So those 5 koshas, when we want to treat, we have to treat the sound and frequency. Okay. So Dev Pasha Chikitsa is so important in every trauma. When we talk about the herbs in the Shotha and trauma, I remember Punannava, Haritaki, Gomutra, cow urine, Shilajit, Karveer are some of the best medicine for inflammation and trauma. To control that Vata, why Punannava? Punar again and Nava means new. Punannava is excellent for the Ambuva Shrotamsi, for the liver, for the Manas. Haritaki. Why Haritaki? Haritaki was one of the most favorite herb of Buddha. Why? Because there is nothing like a Haritaki as per Sattva is concerned, purity is concerned in GI. Without eating the GI and gut bacteria, you cannot treat the inflammation or trauma. There comes Haritaki. Gomutra, best anti-inflammatory and plus one of the best for Ambuva Shrotamsi to treat the trauma. Shilajit, Karveer, these are some of the best medicine for the inflammation. And when we talk of the treat the trauma, because we have to treat not only the Vata, but we have to treat Rasa, Rakta, and Ambu. Blood, plasma, and water resources. These are my 2 cents of today's presentation of trauma, Shotha, and Vata. If you have any questions, please email us at info@ayurvedsadhana.com. And again, before concluding, I remember few Sandarbhaniya Sutra, the best sutras. Mana evam manushyanam vyadhinam karanam, sarvesham roganam mulaha kupita malaha, Achyutananda Govindam Namocharana Bheshajat, Nashyanti Sakala Rogaha, Satyam Satyam Vadamyaham, and develop Nirama Vritti. If you really want to treat trauma, you have to create Nirama Vritti. One psychology is also without ama. Namaste. Take care. Stay safe. Bye-bye.